Samantha Watson. I'm the Executive Director of the SAMFund, and I'm joined by Michelle Zietler, who's our Program Director. Hello. And Lori Marie, who I will introduce in just a minute. Just to give you a couple of quick sort of pieces of information before we get started, this webinar is part of our free webinar series called Moving Forward with Your Financial Health. And you'll see on our YouTube channel, which is youtube.com/SAMFundTV, that we have recordings of all of our past webinars. So we encourage you to check them out and stay in touch with us. Let us know what topics you want us to cover or cover again. And as always, please share them far and wide, because we do this to be as helpful to you as we can possibly be. So please share them with any young adults or anyone in the young adult cancer community that you think would benefit from that information. And with regards to today's webinar, you'll see when we get to the very end that we'll ask you to take a minute or two to complete a follow-up survey. We really rely on your feedback to help us improve the program and, again, make sure that it's as helpful to you as possible. So short of begging, we will just ask you a couple times very, very nicely to please give us some feedback and fill out that survey. You'll also see on your screen that there's a space where you can write in questions. So if anything comes up either that you need clarification on or that you want to ask Laura Marie about, feel free to type those in, and if there's an appropriate time, then Michelle will pass those along to Lori Marie, and if not, then we will just wait till the end of the presentation and she will answer them then. And if anything comes up after the fact, our contact info will be at the end of the webinar, and so feel free to reach out to us at any time and we'll connect you up and help get your questions answered. So okay, let's jump right in. We're really excited about today's topic for a number of reasons. So as you may know, the SAMFund's biggest program is a grants program, and we have read thousands of applications over the years from young adults in their 20s and 30s who are really struggling to get back on their feet after treatment. And as you all know, I know that I'm preaching to the choir here, but as you all know, cancer isn't free. Cancer actually is the opposite of free. And when all of these expenses are in your face and you've had to take time away from work and you have watched your savings dwindle and everything is sort of spiraling downward, a lot of young adults have to make really difficult decisions about which expenses they can take on and which ones they have to just sort of let fall by the wayside. And unfortunately, one of the worst things that we see is people not taking their meds because they can't afford the copays. And that's a terrible thing for obvious reasons, but also because it's preventable. And so we were really, really excited to tackle this subject, to provide resources. This is actually the first in a series of 2 webinars. The next one will be coming up in a couple weeks, so stay tuned for details on that. We'll be letting you know through social media and through email and stuff. But it's such an important topic, and there are so many ways to get assistance with your copays that we just felt like it was very important to focus on this for a little while. So there'll be new content on our website and our toolkit program, and again in this webinar series about this exact topic, because it doesn't have to be either you bankrupt yourself to take your meds or you don't take them at all. There's a lot of space in between there to find support and help. So with that, I will introduce Lori. She grew up in South Florida and has lived in New England since 2001. That is a tough pill to swallow, especially given this winter. A social justice activist since her time at the University of Florida. She's worked as an advocate in the nonprofit and medical sectors. Before joining Needy Meds, she worked as a policy analyst and a lobbyist for the Rhode Island ACLU, a patient advocate at a women's health clinic, and a field interviewer for a study carried out by AIDS Action Committee. Lori is currently the Director of Strategic Partnerships and Education at Needy Meds. She works to increase awareness of Needy Meds resources through facilitating various outreach, advocacy, and educational efforts. She develops and maintains strategic partnerships with other nonprofit organizations and communities that support Needy Meds' mission and oversees the Needy Meds webinar program. So we are so thrilled. We are a huge fan of Needy Meds. We are just really excited to welcome Lori as today's presenter. So with that, I will turn it over to you.
Thank you so much. I really appreciate the warm introduction and the opportunity to be here today. We are great fans of the SAMFund, and we value our partnership with you. Let me just make my screen a little bigger. There we go. So today my aim is to introduce you all to the different types of patient assistance resources that you can find on the Needy Meds website. Well, who is Needy Meds? Here is our homepage. We are a national nonprofit organization. We were founded in the mid-90s by a medical social worker and a retired family physician, Dr. Richard Sagel, who is our current president today. They discovered patient assistance programs, and they thought every patient and every prescriber should know about them. And since it was the 90s and the internet was becoming a major source of information, they decided to create a website. And so even to today, we are known as an informational resource. We're like the yellow pages of patient assistance programs. We do not offer financial assistance directly to patients, but we refer them to programs that do. And currently, about 1.3 million people use our website every year. And this includes patients and their family members, healthcare professionals, patient advocates, social workers, community healthcare workers, and so on. While our website began with just a handful of patient assistance programs, today it's grown to include about 7,000 different programs, and they vary of type of program. So the main types of programs you'll see on the Needy Meds website are prescription assistance programs, diagnosis-based assistance programs for expenses other than medications. We have a section for coupons and rebates. We have a smaller section for government-funded programs and some other tools that a patient might use. And we also have a drug discount card. Well, let's begin with an explanation of what a prescription assistance program is. This is the program you're probably most familiar with already. These are programs that are sponsored by pharmaceutical companies, and they will provide free or discounted medications to people that meet their eligibility requirements. Currently, there's no law requiring a pharmaceutical company to do this, and so not every drug will have a PAP, and the ones that do have PAPs, the pharmaceutical companies can determine whatever eligibility requirements they want, whatever application process they want. There's really no method to the madness. Programs open and close all the time. Their requirements change all the time. The one common thread, however, is that for any prescription assistance program, your prescriber will need to be involved in the application process, and that usually means providing a valid prescription for the medication and also signing the application. Now, this is a prescription assistance program, and as I mentioned, it's sponsored by pharmaceutical manufacturers. There are also copay cards, which are a little bit different. Copay cards are sponsored by foundations, and they frequently run out of the funds in the middle of the year and have to fundraise again for those funds. A copay card will provide assistance for your copayments, and this means that they're typically covering medications that carry hefty copayments. Copay cards are usually for conditions or diseases rather than a specific medication. And they cannot be used with federal programs like the VA, Medicare, etc. But just as PAPs have eligibility requirements that vary from program to program, so do copay card programs. And their eligibility requirements change frequently as well. So one tip that I would give you is don't make a list of copay card programs or PAPs, and certainly don't print out applications to these programs. You want to get a fresh application off the website each time you need to apply for that program. Because the programs change so frequently, you might be using an old application, and that would just add more lag time until you can actually receive the benefit. But just as with PAPs, your prescriber needs to sign off on a copay card application as well. And you'll find copay card programs on the Needy Meds website in the prescription assistance section and also the diagnosis-based assistance section, which I'll point out to you in just a moment. So with that, I will demonstrate the website. So here is the Needy Meds homepage. And there are two ways you can look for help for a specific medication. The first way is to simply type the name of the drug into the drug search box. So for example, chlorambucil. This is pulling up a copay card program run through the Patient Access Network Foundation. Here's what it looks like. If you have any questions about this particular program, please direct them to the Patient Access Network Foundation rather than NeedyMeds. We are the yellow pages that will, give you the means to contact these organizations, but we cannot speak to their applications specifically. So if you have any questions, give them a call at their 866 number, or you can go to their website, and there's a handy link right there for you. We've also provided active PDF links to their application so you can complete them online, print them out, and then have your prescriber sign off on them. The eligibility requirements, this is a section that's probably most important to pay attention to. This is where it will tell you who qualifies for this particular program. These programs vary with eligibility requirements. For a copay card, of course, the applicant must have insurance. So that's what you'll see right here. And it'll tell you what kinds of insurance are eligible, and then the income level you want to pay attention to as well. If you scroll down, the application section will tell you how to submit the application. And in the medication section, it will tell you where the medications will be sent to. In this case, it's the patient's pharmacy. Sometimes it's to a doctor's office. Other times it's directly to the patient's home. It varies from program to program. You also want to take a look at the reapplication timeline. In this particular case, they want you to apply to this program every 12 months. So you might want to mark that date on your calendar as well. So that's a copay card. I said there were two ways to find help for your medications. The second way is to go to the Patient Savings tab, and this is where you'll find all of the patient assistance resources on the NeedyMeds website. This is the clearinghouse right here. So looking at the Patient Savings tab, in the left corner, you'll see that it says Prescription Assistance. You can search for the name of your drug, either by searching the brand name drugs database or the generic name drugs database. If you know the name of the company that manufactures the drug, you can search for that as well. You can search by the application's name if you know it, or the name of the program if you know that. So let's say, for example, I wanted to look up, I wanted to look up altreptamine. Let's see. So I'm in the A's. I scroll down. This is a generic medicine. So I would click on G for generic, scroll down to the A's. Here we see altreptamine or Hexalin, which would be the brand name. And this is a prescription assistance program. Again, this is run through the pharmaceutical, this program is run through RX Outreach. Same setup as before. Again, you want to pay attention to the eligibility requirements. If you don't know if you're living at or below a certain % of the federal poverty level, we have an FPL income calculator. You would type in your annual income here, omit the comma, select yearly, and then calculate, and it will tell you what % of the federal poverty level your income falls within. If you find that you're just slightly over the income level that they're looking to help, we would always recommend making a phone call to the program at their 888 number and asking for an economic hardship exception. There's some subjectivity in this application process, and these organizations and the pharmaceutical companies have the authority to make exceptions to the rule for people, and they do it all the time. Tell them a little bit about yourself and what you're struggling with, and ask for that economic hardship exception. And if you don't get the answer you want the first time, Dr. Sagal would always recommend, he would tell people, hang up, call again a few hours later or even the next day and speak with a different person who may give you a different answer. And that happens all the time. And I'm sure a lot of you are probably getting used to the fact that there are a lot of gaps in the healthcare coverage system in this country, and you've probably had to sort of learn fast on your feet how to advocate for yourself. And this is another one of those situations where if you can be assertive and make a compelling case for yourself, you may go far, and you may win the heart of the person you're speaking with on the phone. Like I said, they do that all the time. If you're just a little bit over, I would say even if you're 10 percentage points over, still don't give up. Still try to get that economic hardship exception. And again, I would remind you, don't print out applications. If you apply for the same programs over and over, get a new application every time you apply, because they do change frequently, and you'll just add more time until you receive the medications if you're dealing with an old application. One thing I want to point out to you here, some of these applications might be intimidating or confusing to people, and they often ask for all sorts of supporting documentation, your tax return forms and all of that. If it's ever overwhelming to you, we have a section right here called Help with Prescription Assistance Applications. If you click on this, it will take you to a directory of organizations that we know about who will help people either for free or a small fee apply to these programs. They'll help you with the paperwork. They'll help you get the applications completed correctly, filled out, and so on. You can search by your zip code, or you can search by your state. So for example, if I wanted to see everything available in New York, there are currently 10 programs in New York that will help you with this paperwork. So we hope that helps people. We know that this can be an intimidating process when you're dealing with an illness and you have a million things to do and you're advocating for yourself. This might make something a little bit easier for you, just so you don't have to deal with the paperwork. And again, these organizations are the ones that we know about. There might be others out there as well. And if you know of any that are not included on our website, please send us an email. We'd love to keep the website as comprehensive as possible. Underneath the Prescription Assistance Application section, we have a directory of clinics all over the country. These are free, low-cost, and sliding scale clinics. We've got about 13,000 of them right now. They're divided between medical and dental clinics. The medical clinics, for example, you will search by state. So let's say I wanted to see everything available in, let's say, Rhode Island. There are 44 clinics in Rhode Island. As you can see, we provide the name, address, the eligibility requirements to be seen at this clinic, and also the services provided. This is where you'll find centers that will do STD testing, women's health services, and so on. In the middle of the Patient Savings tab, you'll see we have a section for diagnosis-based assistance. This is the second major source of financial assistance you'll find for conditions and diseases. So for example, you can search by a diagnosis, you can search by your location, or you can search by the program name if you already know it. So if I want to search for assistance based on my diagnosis, I can search for cancer in general, and it will pull up a directory of organizations all over the country that will help provide for healthcare cost expenses. Generally speaking, this is for expenses other than medications. So you might find, for example, travel reimbursement, durable medical equipment, testing and supplies, wigs for chemotherapy patients, house cleaning services, and so on. There might be a few medicines mixed in here, but mostly it's for other sorts of support. We've organized them first by national service, and then after the national programs, we've got them alphabetized by state. So this is searching for cancer in general. You can also search for a particular type of cancer. So I would go back to the Patient Savings tab, then click on Search by Diagnosis, and then, for example, I can click on B and select breast cancer. I could also search, for example, for pancreatic cancer. And again, they're organized first by national programs and then by states. Going back to the Patient Savings tab, you'll see in the Diagnosis section, we have a listing of camps and retreats. You can search by the diagnosis, by the name of the camp, by the organization sponsoring the camp, or by the camp location. So if I wanted to see, for example, camps for children with cancer, again, it'll list first national camps, programs that accept people from all over the country, and then camps that accept people from specific states, alphabetized by state after that. Going back to the Patient Savings tab in the Diagnosis section, we also have a listing of scholarships. And again, you can search by diagnosis, the residency of the applicant, or by the scholarship name if you know it. We try to be one-stop shopping. We try to be as comprehensive as possible. And if you know of any resources or types of programs that are not currently on the Needy Meds website, please send me an email and let me know what you think should be here, because we want to be user-friendly and we want to be as all-inclusive as possible. So those are the two major ways that you will find assistance for a particular condition or disease or for a medication. Those two sections will give you the greatest dollar amount of savings. The prescription assistance section for free or discounted medications, and then the diagnosis section. Those are the two most important sections. We also have a section for coupons, rebates, and more. This is the third way you might find some savings for your healthcare costs. You can search by the particular product name, or you can search by a category. So clicking on category, there's a category for coupons related to products that might be used by someone living with cancer. And so you'll see an alphabetized list of all of these coupons. There are also rebates in here, and you'll also find free samples. And if it's a prescription medication, it will require a prescription from your prescriber. Going back to the Patient Savings tab, we have state-sponsored programs that you may be interested in. This is where you'll find a directory of programs that are funded either federally or perhaps at the state level or county level. We've got all of the SHIP sites listed in the section as well. We have all of the PACE sites. SHIP is a Medicare counseling program, and PACE is Program of All-Inclusive Care for the Elderly. We've also included in this section, as you can see here, we have the federal poverty guidelines that you can look at, and we also have a tax return request form that you can print out. Underneath that, we have a few smaller resources as well. HealFunder is new to Needy Meds. This is a medical crowdfunding platform that we've recently developed last year. It's like Indiegogo or Kickstarter, except that it's specifically for medical expenses. Patients can start a fundraising campaign to help pay for medical expenses that have already been incurred, or even a procedure that they would like to save up for. And it doesn't have to be a medically necessary procedure. It could also be a cosmetic procedure, or orthodontia for your children, or sex reassignment surgery. We don't discriminate. And I'll also mention that what's different about HealFunder compared to Kickstarter and other crowdfunding platforms is that HealFunder will verify the medical expense by verifying with the physician. And we'll also make sure that the money collected also goes to pay those medical bills. So this is an attempt to try to reduce or eliminate the possibility of fraud. If you're interested in more information about HealFunder, you can click this link here and it will go to my colleague Evan. He's wonderful and he'd be happy to get you started and help you create a compelling campaign for yourself. Also, HealFunder can be used by nonprofit organizations who want to have fundraisers. It comes with your own page, and we would help promote you on our social media pages as well. So that's a tool for nonprofit organizations as well. Going back to the Patient Savings tab, underneath HealFunder, you'll see that there's an MRI CAT scan discount. We've partnered with this company that has about 2,500 imaging centers across the country, and they provide a discount on their MRIs and CAT scans. They say the savings are between 50 to 75% off the cash price of these services. If you're interested in applying, you can click here for an online application, or you can call the 888 number here. Underneath that, you'll see we have a medical bill mediation service. We've partnered with a company that will help negotiate your medical bills. So if you have $1,000 or more in unpaid medical bills, this might be of interest to you. For a fee of $200, this company will be your advocate and will go to bat for you, trying to negotiate down the bills that you've already incurred. $200 is a lot of money, but if, for example, you had a visit to the emergency room when you did not have health care insurance, and your bill might be thousands of dollars, this may be a viable option for you. They say that the savings will be between 30 to 50% of your total bill. If you'd like more information about this program, you can call Needy Meds at our 800 number. And again, going back to the Needy Meds website, the last resource I want to tell you about is the drug discount card. Before I give you the details on this card, I'll just point out that we have a drug pricing calculator right here. If you click on this, it will take you to a third-party website. This goes to the adjudicator, Argus. You can put the name of your drug in. You can select up to 5 pharmacies in your zip code. You fill in the quantity or the day's supply. You click price, and it will provide a table that will give you an estimate of the discount you would receive off the cash price of a medicine at up to 5 pharmacies of your choice. Also, with the drug discount card, if you click on the card like this, this is where you could sign up to receive a free drug discount card, and we can mail one to you. You can print out a downloadable PDF right now. And there's also a pharmacy locator where you would find a directory of pharmacies that participate in our program. Any pharmacy listed in this pharmacy locator is legally contracted to accept the Needy Meds drug discount card. But going back to my PowerPoint, I want to give you a little more information about the drug discount card because this is what I think generates the most curiosity and the most questions from people. So here's the Needy Meds drug discount card. Last month, it saved consumers nearly $4.5 million across the country. It's just another way that patients can save money off of their cost of medications. Users can save between 0 and 80% off the cash price of a prescription, an over-the-counter medicine or supply written as a prescription, for example, aspirin, bandages, glucose testing strips, and so on, and even pet prescriptions if you're purchasing them at a People pharmacy. This card is only good for brick-and-mortar pharmacies. It cannot be used for online purchases. Our card does a pretty good job of saving people money, and we know that because it's used 85% of the time it's presented to the pharmacist. How does the card work? Well, our discount card works the same way all drug discount cards work, and there are a lot of them out there. So you have a pharmaceutical manufacturer, and you have a pharmacy. And through the help of an adjudicator, in this case it's Argus, they negotiate and renegotiate and haggle and fight over discounts. And eventually they come to an agreed upon discount and they lock into a price. The discounts change frequently because they're always renegotiating these prices. So the discounts will vary from month to month and from pharmacy to pharmacy. We always recommend trying the drug discount card every time you make a purchase at the pharmacy because you never know what you'll save. If a product is not discounted one month, it may be discounted the next month. There are no eligibility requirements for this card. You don't sign up for it. There's no registration. There's no activation. It never expires. One card can be used among a whole family. There are, as I mentioned, a lot of drug discount cards out there, but what's different about the Needy Meds card? First of all, it's always free to obtain and always free to use. We never charge users a fee. Second, we don't collect any identifiable information about the people who use our cards. People are not signing up for it, so we're not matching your name to your purchases. And that means that we're not selling your information to third-party marketers. We only track savings. We track the number of times the card is used and the dollar amount of savings. And lastly, because we're a nonprofit and we're not trying to make a profit off of this card, we pass on the greatest savings to the consumer. Every time the card is used, we do collect a small transaction fee, and that fee helps us with the administration of the card and to maintain the website. But again, the card is always free to users, and our transaction fee does not come out of the discount that the consumer receives. All you have to do is bring your drug discount card to the pharmacy with your prescription and ask the pharmacist to tell you what the discount will be. Currently, it's accepted at over 63,000 pharmacies across the country. That's all the major chains like CVS, Walgreens, Rite Aid, and it's also accepted at some of the smaller chains as well. If you ever have trouble using the card, there's an 800 number you can call, which goes to Argus, our adjudicator, and they can straighten out any confusion a pharmacist might have about the card. Who can use the Needy Meds drug discount card? Anyone. Literally anyone can use this card. The only rule, however, is that the card is not combined with health insurance. So if you have public insurance like Medicare or Medicaid, or if you have private insurance, you can use the card instead of your insurance. And you might want to do that if, for example, your copayment is too high, or your deductible is too high, or a drug is not covered under your insurance, or you find that you're in a coverage gap, like the donut hole. You can always ask the pharmacist to tell you which one will give you the greatest savings, your insurance plan versus the drug discount card. More often than not, it's probably going to be your insurance plan that you'd want to go with, but occasionally our drug discount card is better than a copayment. It just varies.
Lori, can I interrupt and ask you a quick question?
Absolutely.
We had a question come in. Can the discount card be used at a doctor's office for medications that are administered in the doctor's office?
No, unfortunately not. The negotiations occur between pharmaceutical companies and pharmacies.
Okay.
As of right now, we don't have any doctor's office involved in the negotiations. And these negotiations result in a contractual obligation to give, to sell the medicine at that particular price.
Mm-hmm. Great. And again, just to clarify, there's no specific eligibility requirements to obtain a card?
Absolutely. You don't have to even give your name. We will just mail you a drug discount card.
All right. Awesome. Thank you.
You're most welcome. And if you want a card, there are a few ways you can get one. As I pointed out on the website, you can print off a paper copy, and that's just as good as the plastic card. Or you can send us a self-addressed stamped envelope to our P.O. box, and we'll mail you a plastic card. If you are an organization and you would like to have drug discount cards for your members, we'd be happy to send you a free supply of drug discount cards and brochures. And you can even customize the card with SAMFund's name and logo on it. If you print them, or if we print them for you in black and white, there's no charge for the customization. And I can give you more information if you want about that. As I mentioned, we do have a couple of tools for your drug discount card. I showed you the drug pricing calculator. Again, that's where you would you click on that on the home page. It takes you to an external party's website. You can search up to 5 pharmacies in your zip code for an approximate price of what you would pay using the Needy Meds drug discount card. Also, if you click on the picture of the drug discount card on the home page, it'll bring you to the pharmacy locator. Any pharmacy listed in that pharmacy finder is contractually obligated to accept the card. And again, if a pharmacist doesn't know that and they tell you that they cannot take your card, or they won't take your card, or they won't check a price for you, simply call the number on the back of your card and Argus will clarify to them that they have to take the card. For organizations, we often design drug discount card applications for smartphones. And we can also design a printable PDF of a card for your website if you wanted. For any individuals out there who think that Needy Meds is doing good service in the community and you'd like people in your community to know about Needy Meds, we have a volunteer ambassador program. Basically, an ambassador might represent Needy Meds at a local health fair or a conference. Maybe that would mean tabling and handing out brochures and drug discount cards, or maybe it would mean giving a 10-minute talk about Needy Meds at your civics or religious group meeting or your PTA meeting or your local library. If you're interested in spreading the word about Needy Meds, please let me know and I'd be happy to give you more information about that volunteer opportunity. And it doesn't matter where you live in the country. We're just trying to reach as many patients as possible. If you would like a copy of this presentation, I'd be happy to give that to you. I can either send it to Michelle and she can send it out to you, or I can send it to you directly. If you have any questions, my email address is lori@needymeds.org. If you want us to mail you a drug discount card, you can email deb@needymeds.org, and there's never a charge for drug discount cards. And if you need some help navigating the website or looking for patient assistance programs, or you have a particular product that you can't find on our website, please call our toll-free helpline. Our helpline representatives are trained to do this for you. They are happy to do the looking for you. They're happy to offer you guidance and in this process. It's a toll-free number. We're open Monday through Friday, 9 to 5 Eastern Time. And so at this time, if anyone has any questions, I'd be happy to answer them.
Sure. We have a couple of them trickling in. How often do you update the resources and organizations on the Needy Meds website?
That's a great question. We have an excellent research team that's dedicated to keeping the website as up-to-date as possible. Some of the programs are updated every 3 months, and some of them are updated maybe every 4 months, and some every 6 months. So it depends on the type of program. But we do have a dedicated research team to doing that. And again, these programs change on a dime. It's not like they have information going out that, oh, these are the guidelines for the next 6 months. No, those guidelines can change whenever they feel like it. So we try to be as up-to-date as possible. But as I said, we don't get any warning as to when things will change with these programs. Programs open and close all the time, and they're constantly tweaking the eligibility requirements. So we try really hard to keep abreast of all those changes. In fact, we have a service on our website. If you go to the Advocates tab, I think it's on the left-hand side of the Advocates tab, there's a program called PAPUS, P-A-P-U-S. That is an acronym for Patient Assistance Program Update Service. You can sign up for weekly or daily email alerts. Every time we update a patient assistance program on our website, I think it's just for the medications. You'll know about it if you sign up for those email alerts.
Great. Let me see what else is coming in here. Just sort of in this similar vein, what does an organization have to do to be listed on your site? Do you have any sort of vetting process when somebody's listed as a resource?
We partner with like-minded organizations that are trying to do good work and help patients. If you have a service that you offer to patients, we are happy to list you. We're very proud to have partnerships with, for example, the AIDS ADAP, which is the AIDS Drug Assistance Program, Consumer Reports, Patient Access Network, RX Outreach, organizations that are doing good work in helping patients. We're also interested in partnering with those organizations, and if you have something interesting you'd like to publish in the Needy Meds newsletter, we'd be happy to entertain that possibility as well. Or if you want to cross-post each other on social media, we're delighted to do that. We always welcome the opportunity to reach a broader audience. But yeah, we always want to have organizations featured on our website that help people.
Great. And is info about Needy Meds being given out in hospitals so patients know about you guys? Because I knew a little bit about you guys. I think on our end, we certainly have referred folks to you guys before when people needed, like, specifically prescription assistance. But you obviously have so many more opportunities and resources, on your site and through your organization. We're just kind of like our jaws are hanging open here, hearing about some of this stuff. We're so excited. So are folks in hospitals getting information about you guys? Is that something that, like, doctors are aware of?
I think that's the biggest problem Needy Meds face is people not knowing about us, and we try really hard. We have a really busy conference schedule this year because we're trying to attend national conferences where we'll meet doctors and surgeons from all over the country. We do a pretty good job of meeting people from clinics across the country. It's harder just to find conferences that target personnel, hospital personnel. That's in part why we have the Volunteer Ambassador Program. If you or anyone out there has a connection to a hospital, or even just your own doctor who may have a connection to a hospital, we would appreciate an opportunity to have a phone call or to do a webinar training for their staff, to show them all the resources I just showed you all today, to send them brochures that they can give to people when they can't afford their medical expenses. So we don't have a concerted effort to reach hospitals, but we're trying.
Great. And let me see, this one's a little bit different, this question's a good one, though. Can Needy Meds help guide me through a conversation with my doctor about the cost of cancer drugs, or help me find out if there are sort of options, discount options for some of the drugs? I guess this sort of brings up like the broader issue of, the cost of drugs in general, and, whether doctors are necessarily, know about or able to share the various, like, whether they're generic formulations of certain drugs. Sometimes this is something the patients just don't know how to broach or how to ask. Does Needy Meds, provide that kind of service, or know of anyone who would provide that kind of service for somebody?
That's a great question. Currently, we don't have a service like that. We tend to focus more on the financial side rather than the patient advocacy side. But there are a lot of national patient advocacy organizations out there. I can certainly do some research for you. I'm sure we're partners with some of those organizations. I know that one thing I remember one advocate saying is that, you can go online, you can go to the Needy Meds website, and you could try to find if a particular medication is covered, and if not, then ask your prescriber, is there a generic version that I might be able to take, or is there a less expensive version that would also work for me? Sometimes there's not, but sometimes there is. That may be a good conversation starter to have. What's really sad is that affordability is something that rarely comes up when a physician is prescribing a medication to a patient. They don't ask. And maybe it's because they feel uncomfortable asking, or they feel like it's not their business, or maybe they don't know that there are resources out there. A lot of prescribers don't know about resources out there. So, yeah, it really does, again, take that you have to be an advocate for yourself and, assert yourself to your prescriber and say, hey, if my insurance isn't going to cover it, and this is my copayment, or this is the cost of it to me out of my own pocket, what can we do about that?
Absolutely, definitely.
But I'd be happy to do a little research and find out where the patient advocacy organizations are, because they might have tip sheets or guidelines about how to broach the subject with a prescriber.
Thank you so much. I'm sure that would be helpful to folks out there. I have one more question about the drug discount card. The question is, how does the Needy Meds drug discount card differ from others that are out there?
Sure. Well, our card is different, first of all, because some of the cards out there will actually charge people a fee to obtain the card. And other cards might charge you a fee each time you use the card. It's called a transaction fee. And we don't do either of those two things. Again, we were founded by a medical social worker and a retired family physician, and the only aim here is just to increase access to medicines and health care for people. So we're not trying to make a profit off of our drug discount cards. Also, we're not collecting confidential information, which is why we don't ask people to sign up for the card. We don't know who's using our cards. They have numbers on them, and you know, an organization might have its own unique number, and so we know, for example, that the American Diabetes Association, who are card partners of ours, you know, saved X thousands of dollars for their constituents in a given month, but we don't know who those constituents are or what they purchased with those cards. So we respect people's confidentiality. And the third reason is because we're a nonprofit, the small transaction fee that Needy Meds earns every time the card is used really just covers our expenses administering the card and maintaining the website and so on. It's, you know, it's not, you know, it's not something we're doing to make a profit.
Mm-hmm.
That's how we're different.
Great, thank you. One other question about the volunteer ambassador program. Is there a time requirement or any other kind of requirement for people who were interested in doing that?
No, there is not. There's a lot of flexibility with this program. It simply means that when something comes up in your area, either the ambassador might hear about it or maybe I might hear about it, we ask the ambassador if he or she would be willing to sit at a table and represent Needy Meds and hand out literature, or even if that ambassador takes the initiative and gives a 10-minute talk at their library or something like that. Mm-hmm. So we don't expect you to volunteer any certain number of hours each month. Maybe I would say if you could aim for maybe doing 3 little things per year, something like that at your own convenience. And if you had to travel or register for an event and there was a registration fee, we would reimburse you for travel expenses and registration fees and so on. We train you. We train you the way we would train any Needy Meds employee, so you'd be as knowledgeable as me about these programs. The training is free, and we would send you all of the supplies and materials for free, and you would just do it as you see fit, as it fits into your life.
Great. Well, I think that is all for the questions. Does anyone have any other questions? If you do, type them on in. All right. I think that we're good.
Excellent. Thank you so much for this opportunity. This is terrific.
Thank you. Hold on just 1 second here while we wrap up here, and then let Sam do our little wrap-up.
Well, Lori, thank you so much for this. I know on behalf of everyone who participated and also everyone who will access this webinar, hopefully at some point later on, you have given us so much information and so many helpful resources, and it just has been a wonderful hour listening to you. So thank you so much for being part of this and for partnering with us on this webinar. We were just thrilled to have you and even more excited now to be able to provide this as a resource excuse me, to our young adult community. So thank you for that. For everybody who is participating right now or listening to the recording afterwards, please take a minute. Again, I'm just going to give one last plug to complete our post-webinar survey. You'll see the link right on your screen. It's bit.ly/needymeds1. We really do take your feedback seriously. We want to know how this presentation was. We want to know what you think of the webinar series. We also want to know what else we can help you with. And we're constantly seeking out partners with organizations like Needy Meds and other professionals in the field, because we know that the needs are out there. We're not experts in a whole lot of things, so we partner with the people who are and really want to be able to provide good, reliable, helpful information to you guys. So please fill out the survey, stay in touch with us, let us know what you thought, what ideas you have. And as I mentioned in the very beginning, this webinar actually is the first in a 2-part series, which we're really excited to tell you about. Stay tuned on our social media channels. We're on Facebook, we're on Twitter, we're on all the big sites, and a whole bunch of others that I don't actually know that well. But Facebook and Twitter are the best ways to stay in touch with us. On Thursday, March 19th at 3 o'clock Eastern Time, we'll be hosting a second part of the prescription assistance webinar. We'll be posting more information about that as it gets closer. Registration should be up in about a week or so. But we're really going to take a lot of the information that was presented today and go even more into detail. So start to understand what some of the terms mean, start to understand the process for getting some of these funds, filling out some of these applications. And it's our hope that it really will be helpful to you and or anyone you know who could benefit from this as you create a plan to really maximize the use of the options that are out there. And hopefully from this past hour or so you have realized that there are so many avenues for support, and we know that prescriptions are expensive no matter what stage of the cancer experience you're in or any other illness that you're dealing with, but the price tag doesn't have to prevent you from taking them at all. There's so many great resources, and Needy Meds, I think like you said in the beginning, Lori, is a yellow pages of just tons of amazing opportunities and mechanisms for support. So please don't skip your meds is the moral of today's story. Please don't skip them. Make sure you're reaching out for help. Reach out to us, reach out to Needy Meds, and let us help you find the assistance that you need so that you can keep taking your meds and keep yourselves healthy and well. So again, on behalf of the SAMFund, I want to thank you guys for participating today, and Lori, especially to you. Thank you so much for this wonderful presentation.
You're welcome.